Good morning, everyone, and thank you for joining us. My name is Daniel Wolf. I'm the director of the Open Society Foundation's Harm Reduction Development Program. An increasing body of evidence, much captured in this report that we are releasing this morning, shows how police practices impedes health care, how experiences of police abuse correlate to increased risk of HIV acquisition for sex workers and people who use drugs and other criminalized groups. Less attention has been paid, however, to solutions or creative ways of addressing this problem. So this morning's press conference and the report is an attempt to move us forward just from problems to some consideration of practical, pragmatic, and important solutions. The report includes case studies from 5 countries that document how public health experts and the police are partnering to help rethink HIV prevention and health. We reproduced that partnership here on the podium and in the audience. We are joined today by Michel Kazatchkine at my left. He's the UN Secretary General's Special Envoy for HIV/AIDS in Eastern Europe and Central Asia, and the former director of the Global Fund to Fight AIDS, TB, and Malaria. By Lam Tian Dung, who's a lieutenant colonel in the People's Police Academy in the green uniform from Vietnam. Jones Blantari, who's the chief superintendent for the Ghana Police Service and the AIDS Control Program. Nick Crofts, who is the director of the Law Enforcement and HIV Network, also known as LEAN, a global network of police and public health advocates. And Jim Pugel, the former police chief at the Seattle Police Department. That is the dais. I'm also very pleased to have with us, and if you could stand, please, Wilson Lamali, who is Chief Inspector and Provincial Police Training Center expert in Kusumu, and Krisanapong Putakul, Lieutenant Colonel from the Royal Thai Police. Thank you very much for joining us. All will be available for photos or interviews after the formal program, which we will hope to keep brief so that you'll have time for questions, and I'm pleased to turn the podium to Michel Kazatchkine. Michel.
Thank you, Daniel. Good morning, everyone. You've been hearing already for the last 2-3 days, for those of you who arrived in Melbourne on Sunday or Saturday in the pre-conference sessions, that we are failing in controlling the epidemic in the most marginalized and in the criminalized populations, in contrast with the remarkable progress that has been achieved globally in the fight against HIV. Among these criminalized and marginalized populations are people who use drugs and sex workers, and that's the focus of the attention today. You may know that among people who use drugs, globally, 1 in 5 at least is infected with HIV, 2 out of 3 is infected with hepatitis C, and rates of co-infections range somewhere between 70 and 90% in that population. In Eastern Europe and Central Asia, we're witnessing the fastest growing AIDS epidemic in the world, and that epidemic is driven by unsafe injection among people who use drugs. But Eastern Europe and Central Asia is not the only place in the world where this is happening. We see this across many countries in Asia, and if we look at other places in the world, including in Africa, everywhere the prevalence and the incidence of HIV among criminalized populations is by far higher than in the general population. Now, laws and policies, the legal environment and law enforcement are actually an important factor, an important reason why this is happening and why people do not access services. At what I call the macro level, the legal level, many countries, despite the evidence, continue with harsh penalty, prohibitionist policies that we know are associated with elevated risk behaviors. But at the community level, on the ground level, it is about policing, and it is about the relationship between police, law enforcement, the health sector, and the communities. And as Daniel just said, and as you will see in the report, there is ample evidence that policing practices such as arrests for drug possession or syringe possession, client harassment, using condoms or condom wrappers as evidence of criminal wrongdoing, random urine testing, or extrajudicial practices, behaviors such as extorting bribes, physical or sexual violence. All of these obviously directly and negatively impacts on behavior, perception, health outcomes of people who use drugs, sex workers in the communities. In Ukraine, it's been shown that the fear of arrest is actually one of the key drivers of the epidemic, and many such examples have now been documented. And this is why, as we all have to advocate for drug policy reforms, for legal changes that will build the enabling environment that we need, we also need to rethink the relationship between law enforcement, health sector, and communities. We need to rethink our law enforcement strategies, and that is what this press conference is about. It's about building bridges. It's about shifting the environment from one that targets vulnerable people as the object of enforcement and exacerbate risks to an environment that will actually promote health and safe communities. So I look forward to listening to my colleagues. This is the outcome of a session we had yesterday afternoon. This is also the launch of the report Daniel mentioned to you. Please think about innovative, non-expensive strategies that can really save lives on the ground.
Thank you, Michel. And yesterday I was struck by a contrast. As public health experts, we often refer to sex workers and people who use drugs as so-called hard-to-reach populations, but the reality is that the police in many countries seem to have little difficulty in reaching them. Unfortunately, they often reach them with punishment and fear, and no health system can work. No AIDS target can be reached if people are afraid to use the services for fear of arrest. It struck me yesterday that reform of police practice in some ways is as critical to HIV prevention as a clean needle or a condom. I'd like to turn to our police colleagues. Lieutenant Colonel Zung, you come from Vietnam, and I wonder if you can share a little bit of the experiences that brought you to this podium and to thinking about HIV and sex workers and drug users.
Thank you, Daniel. My name is Lam Tiên Dung. I'm a lecturer of the People Police Academy of Vietnam. And I would like to share our experience in the fight against HIV. Before we start our program, our perception towards HIV is that this is not the role of the police officer, and we often have a negative attitude toward the most at-risk population. And of course, we have a poor history of multi-sectoral collaboration with other stakeholders in the fight against HIV. And even at the first meeting with some NGO and IDU and sex worker, one sex worker even said that I hate you because you and your friend arrested me many times or something like that. But then after we started our program, we are changing the attitude of the police officer towards the most at-risk population. And as an educational institute in Vietnam, our role is to provide the excellent quality and evidence-based education to the police officer. I think that we should play more important role in the fight against HIV in the future. Thank you.
Thanks. Chief Superintendent Blantari, I wonder if you could tell us a little bit about the Ghana experience.
Thank you, Mr. Moderator, and thank you, ladies and gentlemen. My name is Chief Superintendent Jones Blantari. I work with the Ghana Police AIDS Control Program. And as a country, we realize that with our HIV prevalence of 1.3, there are certain drivers of the population whose percentage of infection is so high. I'm talking about sex workers that have a prevalence of 11.2%. Then we are talking about MSMs who have a prevalence of 17.5%. And therefore, realizing this as a national strategy, the Ghana Police realized that it has a role to play so that we don't antagonize these populations, thereby forcing them to go underground and then increase the rate of infection. So what did we put in place? The issue was tackled at 3 levels. The first one at the strategic level, where we had to convince the police administration about the need for police to use the public health approach in law enforcement, where we don't run after these key populations and forcing them to go underground, but we should be accommodating enough so that they can come out and receive services. And then at the second level, after the police administration has given the go-ahead, we try to tackle those who are in the system already by introducing in-service trainings to our target population. And in in-service trainings, we dealt with issues of human rights abuses of the key populations. We're talking about stigma and discrimination, and we're talking about gender-based violence. And these are the 3 issues that we think the police we can help in order to mitigate the rates of infection. And at the 3rd level is to introduce these key topics into our training curriculum. And actually we developed, PEPFAR helped us to develop a new training curriculum that includes topics on gender-based violence, human rights abuses, stigma and discrimination. And these subjects are examinable. So it means that before the policeman comes out of the training school, a minimum of 6 months, he has all the information about all these things. So he has a better approach towards these key populations. And we ourselves, we also developed a documentary to catalog the abuses of police, how police personnel abuse these key populations, and then the consequences of you being arrested. We did the documentary, and then we show it to policemen that when you are arrested, we will treat you as a criminal, because what you perpetrate against the key population is a higher crime than what you are talking about the key population, because we talk about sex work, which is criminalized in Ghana, but it's a misdemeanor. But if you go and you harass the sex worker, you are committing a bigger offense than that one, and then you'll be dealt with according to the police rules and regulations. And therefore, these are the 3 structures that were put in place. And then the issue of condoms, we hear all over the world that the police harass key populations with condoms. And what strategy did we use? We produced condoms and were able to convince the Inspector General of Police to make the condom pouch as part of the police uniform. Therefore, each policeman has a condom pouch with a condom inside. So if you have that one, you don't have any moral authority to see somebody with a condom pouch and then you arrest that person. And I can tell you, even here, I have my condom pouch with me. It's in my uniform. So this has actually been approved by the police administration, and you have condoms inside. So you don't have any legal basis to see somebody in the streets and then arrest the person for possessing condoms. So these are the structures we have put in place in brief, and then when it's question time, I answer your concerns. Thank you so much.
Thank you. Professor Crofts, how unusual are these police officers here today?
The police have traditionally been seen in a lot of circumstances in relation to HIV as being part of the problem, and in some countries and many times that is absolutely true. But we see the police as part of the solution. There are many countries in which police have been critical partners and police agencies have been critical partners in the HIV response. I think immediately of countries I've worked in, the UK, Australia, Netherlands, places like that, but increasingly there are police around the world who are seeing that traditional approaches to policing of communities who are most vulnerable to HIV is causing more problems and more damage than alternative approaches. Police see, first front line, the devastating impact of criminalisation, of prohibition, of the rampant epidemics of HIV among these communities, and police increasingly are becoming frustrated in many parts of the world with filling prisons with people who need health care rather than handcuffs. My organisation, the Law Enforcement and HIV Network, is working with police in many countries around the world to partner them with HIV experts, HIV programs, and particularly with civil society, and to work within police agencies to bring about cultural change, as you've heard, to reverse the impact of bad policing practice and of punitive laws. We have 15 country focal points on 4 continents, and we are growing rapidly. 4 of our country focal points are here, and you've heard a little bit about the work that they're doing within their own agencies to change the iniquitous situations. We have the Law Enforcement HIV Network has produced a statement of support for harm reduction approaches to policing vulnerable communities, which currently has over 10,000 signatures of police officers serving and retired around the world, and is increasingly being signed up to by police agencies. One of the most recent police agencies to sign the statement is the Seattle Police Department. Thank you to Jim. So this statement is calling for a rethink of policing approaches to vulnerable communities in the light of current punitive laws. Thank you.
So let's turn to the U.S. It is not the case that the drug war exists only in Africa and Asia and Eastern Europe, but obviously in the United States as well. Jim Pugel, can you share your experiences from Seattle?
Sure. I think a lot of what I can say has already been said. The police departments around the world do play either a positive role or a negative role in the health and the safety of the community. The traditional role of police officers has been to reflect what the traditions, what the values, and what the goals of the community are, and ideally do that lawfully and with compassion while working along with all of the interested partners. Unfortunately, as you've heard here today, and as all the research shows, the traditional police approaches, certainly in the United States, in the city of Seattle, and unfortunately around the world, which has copied much of American law enforcement, has hurt public health initiatives by negative enforcement. As you heard Michelle say, there's a disproportionate amount of HIV and hepatitis C and other blood-borne illnesses in the criminalized population and the marginalized population. And it's imperative that police commanders and police officers on the street work in partnership. Yes, we police have to hold everyone accountable to the laws, but we have to examine the way that we enforce those laws and determine if what we as police officers and prosecutors and judges are doing is having a negative impact and causing more harm than what the initial law was designed to prevent. And in Seattle, after years and years of working in silos and bringing legal actions against one another, whether it was the American Civil Liberties Union, the prosecutor's office, the elected officials, the police departments, or the King County Sheriff's Office, we all finally sat down and determined that our approach, our collective approach, whether we were arresting, prosecuting, or defending the marginalized people, the ill people, the addicted, the criminalized people, we were not helping them. And we were focused on our own missions. So an initiative, and I can speak individually or answer questions afterwards, but just briefly, we as a collective group, as a consensus-based group, began what's known as law enforcement assisted diversion, which at the point of arrest, an officer can take a low-level nonviolent drug user, an addicted person, a sex worker, or even a nonviolent, low-level, non-predatory drug dealer who is dealing small amounts of any drug. If that person is amenable to developing a case management plan with a caseworker, then that officer can immediately turn the individual over to the case manager, and they develop a plan. The police are still involved in helping keep that person on course. It is a harm reduction model. It's not an abstinence-based model. We found that most abstinence-based models do not work. Technically, the police officers involved in this initiative are ignoring what the letter of the law says. The letter of the law says you have to arrest people who have drugs. But only through a consensus-based approach where everyone collaboratively came together, we recognize what the law is, but until that law is changed, the people on the ground, the prosecutors, the elected officials, and the police commanders saw that it's not working and it's producing harm and increasing the transmission of HIV and other bloodborne pathogens and criminalizing people that really are ill or need help. I'm just very impressed with the amount of police professionals who are here at a conference that has traditionally been at odds, or that the police have been at odds with, and not traditionally helped. So this is very promising for me to read, to listen to, and then also read the very positive stories in this Protect and Serve document. Thank you.
Thanks. At this time, I'd like to open it up for questions, both for those of us on the dais and also if there are any questions for our colleagues who are also officers from Kenya and Thailand. Please. Oh, and could you identify yourself, and I don't know if there, maybe use the microphone on the side.
Melissa from The Guardian Australia, and this is perhaps a question for Jones, but what level of risk do you personally put yourself under when you go against the laws that you were supposed to adhere to and say that it's not working and you're going to try a new approach?
Thank you so much. You know, the laws are for man and not man for the law. So in trying to enforce the law and you see that it's not working, you have to find innovative ways to go about that law. At the end of it all, who are you protecting? You are protecting the human being. But if the law is working against the welfare or the public health of that individual, that means you are not achieving anything. So you must create space for that human being that you are supposed to protect to have the ability or the energy to come out and live a good life, and then you, as the policeman, what you do is that you encourage that person to do good. I mean, to lead healthy behavior. Like I was saying in my case, there are times that we meet the sex workers, we have discussions with them about the responsibilities to society, their responsibilities to society, whilst the law is there. Because if they have a responsibility to society, as we are also having a human rights, that we protect their human rights. So if they don't follow their responsibilities, then it means they will come into conflict with the law. And some of these responsibilities they may not know. So sometimes we tell them, we encourage them to do this, and then you see that we have a win-win situation. Thank you so much.
So I see a number of questions. I'll go to this side of the room next, please.
Hello, greetings. Etisane.
Eye
Boko. Actually, my name is Sister Ya, and I am from Chicago. I'm here representing the Black AIDS Institute, and of course our local CAN TV, where we do HIV science. So actually, Mr. Jim Pagel, I know you're out of Seattle, so what I really wanted to know is, I haven't heard about the law enforcement assessment divergent document, and I wanted to know how is that being promoted to other places, especially like out of Chicago, because I'm sure everybody sitting here understands what we're dealing with in our city, but we're not just that, so don't let the violence override that there are activists and very passionate people, but we are against criminalizing HIV. And so I want to know how you've been promoting that document to other places, and where can we, how can we get involved with that to make sure it gets to our area?
Right. It's been a struggle to an extent to promote it. Thanks to the Ford Foundation, to Open Society Foundation, and some local Seattle foundations, we've been able to initially fund the development and the implementation. Finally, this year, the City Council decided to expand, not citywide, but a much larger geographic footprint. That's allowed us to advertise it in a positive way, not to say, look how well we've done or what this neat program is, but we've been able to share it with other police departments. A contingent of us from Seattle and the King County area visited Chicago, South Side, about 2 years ago. And that was just when we started to develop it. There was an open society, or I'm sorry, a civil society group, I forget the name, that hosted a symposium at one of the churches, and we explained what it was. Since that time, we've been able to help Santa Fe, New Mexico, develop the program. They implemented it about 4 months ago. Albany, New York, we have visited them and are actively working with them on developing it. Innovative prosecutors and police chiefs, some from San Francisco, Houston, and other jurisdictions have either visited Seattle or we have sent delegates to their locations to explain. It's symposiums like this, it's conventions like this, where all of these positive police, community, civil society groups that have come together and worked while not ignoring the law, recognizing that the politicians are too slow to change the law. So we on the street have to work creatively until they can catch up with what the health workers, what the professionals, what the police officers really see is happening. I can easily talk with you afterwards and give you more information and my contact.
Yes, and I'd like to say again, thank you all for doing this, and especially the police officers in our country. You know, we would call this civil disobedience, so keep it up.
Please.
This on? Campbell Kearney from Pacific Beat on Radio Australia, which is what's left of the ABC's international broadcasting service. I'm just curious, while it's very, very impressive, when you're trying to provide this training to your officers, and any of you guys can answer this, do you have issues with them coming up against their own social, religious beliefs when it comes to dealing with people with HIV, and how do you overcome that on an officer-to-officer basis?
Thanks. Actually, I'd like to ask Wilson if he could take the first response to that, since you've had so much experience in training, and if you wouldn't mind just, maybe you could just step to the microphone there.
Oh, okay. How do you deal with officers who find their own social and religious beliefs oppose that dealing the way you want to train dealing with HIV and sexual rights?
Wilson, can you use the microphone?
Thank you very much for the question you put across. But first of all, I'd like to address a question that was put across by our sister here that was being answered by Chief Superintendent Jones. I would like to tell you categorically that
you know, in most of my trainings, what I do is that we tell our policemen that divorce your moral beliefs from pure policing functions. If you are coming with the background of morality, then you cannot be a good policeman. So try to shut off your moral issues, and then on Sunday or Friday, if you are going to the mosque, you put them on. But if you are doing pure policing work, divorce the two, and you will be a good policeman.
Please.
Hi, James Finlay, Gay News Network Australia. I realise that there's a focus on people who inject drugs and sex workers in your report, but why is there no focus on men who have sex with men, gay men, considering many countries carry a high penalty for sexual activity between two men, especially in Ghana is one of them. It's not just a misdemeanour, but quite a considerable amount of prison time.
Yes.
So, Jones, why don't you start, and then I'd also like to go to Wilson too. The short answer is that there are similar activities going on in different parts of the world around men who have sex with men or gay men. They weren't the focus of this report, but some of the officers have some experience, and then some not represented here. But Jones, please.
Okay, the issue of men who have sex with men, within the police service, we said acts done publicly. If you are doing something in the confines of your room, a policeman will not have to be chasing you to look at what happens in your bedroom. So how do I know that maybe a man is sleeping with a man? Most of the times what we experience in our country is when there is conflict between both parties, and then they come out to announce to the world that this is what is happening. A typical example is there is an NGO that deals with MSMs in Ghana. Then they go for a meeting. Then they were supposed to be paid stipends. And then the money was not forthcoming. Then somebody carries the computer. Somebody carries a printer and says, look, we go to the police. I'll tell the police what we do, which is a form of blackmail. And it's very rampant in the MSM community, especially in our part of the world. And when I hear that story, I tell you that I am a policeman. Come and tell me what you do, but I'll arrest you for what? Stealing. Because what you've done is stealing and has nothing to do with your sexual orientation. Because I will not come to look for what you do in your closet. But if you steal, that one, I will chase you and arrest you. So forget about your sexual orientation, but make sure that you follow the rules and regulations. That's why I talked about responsibilities of the key populations too. Thank you so much.
Thanks. Actually, let's go to the next question because I see quite a few people waiting, and I'm mindful of time, and there's another press conference in the room fairly shortly. So please.
My name's Christian Vega. I'm from Edge Radio in Tasmania here in Australia. I'm just wondering, you describe it as cultural change. It is cultural change, and it's quite an amazing progressive step to challenge HIV. I'm wondering what you see your role is in terms of advocating for cultural change amongst other police departments who don't necessarily agree with you, and what you see the future of that looking like.
And maybe we could ask Lieutenant Colonel Zong to take the response to that.
Well, thank you, Christine, for the question. As I said before, it's quite difficult. It's a long way to change the behavior of the police officer toward the most at-risk population. And even some police officers, or even some of my students, they ask, why do we have to spend money and time and human resources to have the person who are our target? You know, because we often see the sex worker or drug user like the potential offender. So sometimes it's quite difficult, and some of them are conservative, but I think that it's a long way to do. We are changing our curriculum, and we are trying to incorporate the information of HIV and the fight against HIV for the police officer. So we believe that at the moment we have some changes. And yesterday, one of the sex workers who also attends this conference, she said that that's the girl that I mentioned in the meeting, the first meeting when I met her. She said that I hate you. But now she said that, okay, Zung, during the recent meeting with the police and local authority, they have full support to get the health care service, and even they have full support to access to methadone program. So I think this is a very positive progress in my country, and I hope that in the near future we can change the way of working of the police officer. Thank you.
Jones, I see you, but Nick, I know, wants to come in and hasn't had a chance yet. Yeah. So, Nick, please.
In terms of spreading the message, This is work that should have been going on over the last 2 decades. In terms of working with other communities like MSM, LGBTI communities, this is work that should have been going on, and this has been a neglected sector. In every police agency that I know, I should qualify that, in most police agencies I know, there are police who want change. What we're doing with the Law Enforcement HIV Network is bringing them together. We know about peer education and peer advocacy and the strength of the peer approach in many communities. This is now coming into the police community, so that those police who do see that there is a different way of doing things in agencies that aren't supportive are becoming part of a global peer support network to bring about change. It's only part of the process. The change that Michelle has been a huge champion for and has talked about decriminalisation, about changing law, about law reform and so on, is a fundamental necessity. This is a process of supporting that, as Jim has said, from the ground up, as it were. So the message is spreading. It also should be noted that there is reform going on in police agencies around the world. This is a global phenomenon of police professionalisation, moving towards evidence-based policing. You know, this is something that we are linking into. We are just part of.
Jones? Oh, I'm sorry. Jones, hold your thought for a moment, and let's take your question, and then we'll come back.
Okay. I'm Paul Ben Kimoun with the French daily Le Monde in Paris. My question is, we'll start just by a comment that I'm impressed to see high-ranking police officers taking such stand, as I'm not sure I can think of the equivalent in my country doing the same thing. So my question would be, would you comment or elaborate on the way that the leadership you're are showing us could influence and the exchange, the collaboration you may have with your colleagues in Europe and in France, for instance?
Can I just say that we have been searching for a French country focal point police officer, and we have not succeeded yet.
So actually, I'll ask Jones to respond first, because I know he was waiting, and then Michelle, as the only representative of the only French citizen on the panel, I might ask you to comment too. So the question: how could you inspire others in Europe and elsewhere?
You know, what we've done in Ghana is for you to build trust around you. Trust is very critical, and when the people trust in you, whatever you tell them, they know that, okay, this guy at least is truthful. Then the second one is mapping out. You don't expect all policemen to accept your message hook, line, and sinker. You map out, and then you identify those who are prone to your cause. And then if you are able to win them to you, then we have this snowball effect. They also go and affect other people. So that is the system we are using in Ghana.
Yeah, Wilson, please. But you have to step to the microphone.
Other colleagues of ours in the field can still be lured to this program. And I believe police work is not all about walking in the streets, patrolling, and trying to be seen working. Criminals have started changing their ways of approaching issues, and they are becoming more technical and dynamic in their approaches. So the police, on the other hand, need also try to create ways that can be able to address crimes that come along the streets. And one of them is the way we are taking, the course we are taking. I'm very certain when we talk of IDUs, when we talk of sex workers, these are people who are out in the streets with policemen. And they are there every time, day and night. And should the police accept to be close to them, they can be a very good source of information to identify for them criminals and also try to prevent some crimes, some bigger crimes happening within the area where they operate, because they would like also to have a safe environment. And I'm very certain if you use these words to your colleagues, they will always go by your word. Thank you.
Thanks. So I want to give the last word to Michel, because the last question was from Le Monde. Michel, what would you say to your French colleagues?
Well, I would say, I don't know how hard we've tried, actually. What I would certainly believe is that we have to look for the individuals rather than address the system. Because, as you could see on the panel, it is about compassionate individuals who understand the issues and who are then brave enough to use the discretionary power of the police officer to, let me say, softly defect the law. We do have to find those individuals until one day the evidence that we are trying, all of us, to present every day will change the law and prioritize health, public health, and the safety of people over some of the myths about prohibition.
Thank you all. There's another press conference waiting to occupy the space, so people will be available to talk outside, and thank you for your attention.